Welcome, Wakefield, to our weekly COVID-19 update venue here. Joining us today are Superintendent of Schools Doug Lyons, our Healthcare Director Ruth Clay, our Emergency Management Director Tom Walsh, Ann Santos, Chair of the Wakefield Town Council, and Laura Gorville, a member of the Board of Health in Wakefield. And welcome to our faithful watchers as I see you coming on here to the Zoom call as well. Some relatively good news today, and if we put on the chart, Ian. Thank you very much. And as you can see, Wakefield, and I'm very proud of the community, has worked hard in socially distancing and wearing your masks and keeping the whole congregations down. And we have now crossed down from the red into yellow. I think we've been red since after Thanksgiving, so this is a great achievement by the town, and we did it in a very slow, methodical manner. So I want to thank the town, thank the people for wearing one or two of these and keeping your distance. So the theme of the day is "Call Me Mellow Yellow." Come on, join in. Old song. The youngsters.
That's right.
Call me mellow. That's right. Yeah. And if we can go to the map, good news really in the whole area. As many cities and towns are crossing into the yellow from red. Still in the denser populations, it's still tough, and there's still, I think, 140 communities or so that are still red, or maybe it's 110. Keep the numbers down, but great that we're in the yellow. Let's keep up the good work, and we want to sing like Kermit the Frog in a few more weeks here, entering into the green program. So proud of Wakefield. Our 172 positive cases the last 2 weeks, and that's way down from what it were before. So I really think the community did a great job, less than 5% positivity. So give yourself a pat on the back, townspeople, for doing that, and we do really appreciate your cooperation here. More exciting news, and I'll turn it over to Ruth and to Tom, as we had our clinics and have another one scheduled, and really exciting as we get more and more people vaccinated and rounding the corner and beating the scourge. So Ruth, why don't we go to you, and you can give us a few words of wisdom.
Thanks, Steve. Yeah, we're well into starting to do vaccinations. I wish it was on a more regular basis, but again, we do them as we get vaccine. So as more vaccine becomes available, we will continue to do additional clinics. So we have the second dose clinic for the 1,400 people that came out in the snowstorm on February 1st. And they will all be receiving their second doses on February 22nd. And then we have a clinic on February 26th, which is a Friday, for Wakefield residents only who are 75 and older, and one caregiver. One caregiver. They don't have to live in Wakefield. They do need an appointment, so they do need to register. They may not have exactly the same time as their 75 plus person, but it will vaccinate both of them at the same time. It doesn't matter which appointment they both come in on. So this, I know a lot of people have seen the announcement by the governor's office about the companions. The governor's announcement only pertained to the state-run mass vaccination sites, but there was a local option, and the Wakefield Board of Health met last night and adopted that policy. So people who are 75 or older who live in Wakefield can have the person who drives them or who's there with them can also be vaccinated. They need their own appointment and they need to register themselves also. We have about 700 doses for that clinic, and we only have 200 and, what did I say last night? 200, roughly 260 people signed up right now. And I have gone through them, and all but 4 are eligible for the clinic. So it's a real number. So there's plenty of vaccine for this clinic, and we're doing it specifically for 75 and older, not people in phase 1, because we really want to prioritize our people 75 and older. We have gotten feedback that a number of our residents have received their first vaccine through their primary care physician, or they've gone to one of the mass vaccination sites. The closest to us is in Danvers at the Doubletree, but there's 2 in Boston at Fenway Park and Reggie Lewis Center. And of course, everybody knows about Foxborough, but it's kind of a haul. So the good news is it seems that our 75 plus population is getting vaccinated, which is the most important thing. And next Friday, we're really hoping to be able to significantly impact anybody who's 75 or older who has not yet gotten their first dose.
Right, it's really 2 weeks, 2 weeks from,
yeah,
not next Friday, the Friday after.
Yes, it's a Friday. So I just want to repeat, though, that people coming on the 22nd, even if you're 75 and older, we cannot vaccinate your companions then, because the vaccine we receive for that clinic is based on how many we gave at the first clinic. So we don't have the vaccine to be able to do the people at that clinic. Just so there's no confusion, and I'm sure there'll still be some confusion, but Steve will be the bouncer again, so.
Right, and please don't overwhelm us with calls for the clinic on the 22nd, because there are no vaccines for you. That is just, they've all been accounted for exactly the people that came in before. So even if you were kind enough to drive your loved one there, as many did, wonderful that you did it. Don't think that just bumps you into the first shot. It's not going to happen. So thank you, Ruth.
Can I just put one more, anticipate one other question? The state is, when you register, you click a drop down and say which category you're in. They haven't added the caregiver category yet. So we're already getting calls about that. So put yourself in as a home-based healthcare worker for now, because I don't know, it's kind of the closest there is. And hopefully soon they'll put that up as a separate category.
Thank you, Ruth. Great job through this whole thing. Tom, anything to add?
Yeah, emergency management, all we're doing now is we're concentrating on getting that site, the clinic site, up to snuff, and making some changes, alterations, because we're getting prepared. Hopefully that we'll get further into the phase 2, which is a lot of groups, and then eventually, hopefully, we get into the phase 3, which would be the general public. So that's what we're concentrating basically on now.
Great, thank you, Tom. Great job, both Ruth and Tom, in pulling this off. Really, we are the envy of everybody around us, and I really appreciate what you guys are doing all the time. Chair Santos, words of wisdom.
No, but I have a question. My wisdom's all tapped out. So Ruth, for those of us who have souls and conscience and aren't selfish, I would never think, although I'm a caretaker to someone over 80, I would never think, who signed up for the 26th, and I will drive him because he'll ignore Waze and end up in New Hampshire. I would never think of taking a vaccine because I want it to go to people over 75 right now. but you just mentioned only 226 are signed up. What is your advice? And I'm not asking for me because I'm still uncomfortable taking a vaccine when I'm not in that group, other than being a caretaker, I guess. But there's going to be sleazy people who are going to be hooking on to over 75. I have no doubt. We'll have them in town. We'll have them out of town. But for those people, yeah, I'm sure it's already happening. This is not going to show the best angels of ourselves, I'm sure. But do you understand my question? If there are, do you think you're going to fill up with legitimate 75 plus vaccines? So someone like me shouldn't register.
The concept behind the caregiver was to address potential barriers for the seniors from being vaccinated. So the governor's concept here is to make it as easy as possible for 75 and olders to get vaccinated. And access and transportation is one of the main issues for the elderly. So he did not want somebody who was older not to get vaccinated because they didn't have anybody to take them, or for whatever reason. So he was trying to make it as easy as possible for these people. And as we saw at the last clinic, some of them, really need a caretaker with them to take care of them even at the clinic. So that's the concept. However, the general public is very, very anxious to be vaccinated, and we understand that, and we're glad that they want to be vaccinated. And human nature being what it is, people are taking advantage of it. I should have also mentioned, though, for the general public, that Mystic Valley, we're part of Mystic Valley Elder Services catchment area. And anybody, no income requirements, anybody who's 60 or over, when it's their time to be vaccinated, can call Mystic Valley 781-324-7705. I know Jen will put that up. And you can get a round trip taxi voucher for both of the clinics. So we're fortunate in our area that we've really tried to address as many barriers as possible to make sure that everybody who's 75 and older has access. We will be able to do a limited number of homebound. So we're working on a list for that too. So that is the concept, and the good guys will always be the good guys, and the others will always try to take advantage.
Right. So I would suggest someone in my position, even if I'm driving my father there, I'm going to stay in the car because he can get out of the car and he can walk into the clinic, and I don't need it. Someone else needs it more than I am. But I know, I just hope people in my position will appreciate that. And, there's other home healthcare workers, there's other companions that need it more. So that's my words of wisdom, I guess. Thank you for everything you've done.
Thank you, Ann. Laurel?
Yeah, we'll just stay on the same topic. So my only other thoughts to add to that, in the world of public health, this is a good idea, except that we've got scarcity and we've got to figure all these doses out. So once again, we've already gotten people signed up to be companions for that second dose clinic, and we can't, they're going to get a call back. That's not going to be able to do that. I also want to assure people that in our post meeting from that February 1st clinic, we really added, we really had an understanding of what kind of support we had. So we're adding more people to assist folks from cars to the building. You can still come in, if everyone is masked and staying in their distance positions. Care providers who are supporting the person being vaccinated can certainly come. One of the medical caveats I thought about when this announcement was made was, what if the companion doesn't do well with the vaccine, and then we've got two people stranded at clinic? That's one of my thoughts. The other is we are beginning to, as we're rolling in the second vaccine, we are hearing that people feel kind of crummy the next day. Generally, the younger you are, the crummier you feel. So that makes me also wonder, on a kind of practical sense, I don't want the caregiver down and out the next day after vaccine. So there may be some medical wisdom, but again, it was a good overarching plan when you think of the underserved community, people who can't, who don't have home health services. We know the statistics in the country are enormous about people who have sacrificed their own jobs and such to be caregivers. They haven't been able to, that's the choice their family has made. So, I fully support that those people should have always been kind of, medical providers. So, we'll get there. I cannot wait to open things up a little bit more so we won't have to dance around all of these criteria, but it really is the best we can do with a slow, with a rollout of vaccine. We have to control it somehow. Not perfect. So we'll get there. So please be patient. Please do know that everybody who's working in that clinic, especially in leadership, are under a lot of duress in kind of micromanage, getting that right. And the people on the phone lines are really getting hit because lots of questions are coming in. So I thank Jennifer McDonald because she's really tried to make things much more clear on the website. And we'll go from there, and we'll just keep at it.
Yeah, thank you, Laura. Well, one thing I would point out is that according to the latest census, we probably have over 2,000 people in Wakefield that are over 75. Roughly 300 were at the first clinic. We've had probably 300 probably by now sign up for the second clinic. That doesn't get us halfway there yet. So for the population that is over 75, let me assure you that this is safe, this is well run, there's plenty of room for social distancing when you get there. The ventilation is good. Tom and his team and Ruth have done a great job in making this building as comfortable as possible and as safe as possible. You have EMTs there. You have a lot of support there. If you need a ride, Ruth gave you the number. You can also call the senior center at 781-245-3312. Did I get that right? I find it all the time. And they can help you out as well. So please take advantage of this because we do want to serve that most vulnerable population. The thing that we don't know, and this came up last night at the Board of Health meeting, and it would be wonderful if we had this information from the state, because all of these vaccines are, or the vast majority are in the PrepMod system, so we can find out, is how many people with the zip code of 01880 over 75 have been vaccinated. That would be great information for us to know, right? So hopefully the state can give us that information, because, and be great if we, I guess we will never get the names, but it'd be great if we could almost go door to door, because let's say that we know that 1,500 are done, and we knew the 500 that didn't, we could contact them and say, hey, what can we do to help you? So I know there's HIPAA rules and things like that, but I'd love to be able to make sure that every person got contacted. So please consult our website. If not, call. We'll turn you over. We're returning calls and signing people up. Great job by the people in the office at the Board of Health and at the Senior Center that are calling people back. So please take advantage of this. And I do agree. We'd love to open it up more, but we have the system is given to us, right? We are told these are the categories that we can vaccinate. So that's what we have to do. That's the rule. We can't change that. But thrilled that we have this. And again, a lot of other communities don't have the ability to do this. And thank you to Ruth and Tom that we're getting this done. Shifting over to the schools. Another day's a good day, right, Doug? We're in the classroom.
Every day in the classroom is a terrific day for us. And so we want to thank, of course, all of our teachers, faculty, and staff for continuing to put forth just really an amazing effort and work ethic every day. We didn't know after Christmas, we were hearing, like everyone that was watching the news, we didn't know what a second spike would bring. we didn't know if that meant that we would be able to get through the month of January. And so I know some districts had put off coming back on January 4th for fear of a second spike. I think, our calculus was, or our thinking was that, if it was going to hit us, it was going to hit us later in January. And fortunately, we were able to work through it, and we didn't get it didn't come the way we thought that it would. So we've been in session for 6 weeks. Today is the day before February break. And again, I think we're grateful. And so I appreciate everyone's efforts to kind of keep our schedules going. I think if I could build on some of Laurel's words, right? And I feel like we can't say it enough as a leadership group. We will get there, right? We will get there. And just speaking to vaccinations, I can tell you, I speak for all of our teachers that are just chomping at the bit to get vaccinated, to get the opportunity to get vaccinated. And we are kind of looking at the calendar, and we know that vaccinations are a mitigation strategy. And if we can get our faculty and staff vaccinated, by the end of March, I don't know if we could by the end of March, but this is what we're thinking about. If we can do that, that's going to be part of the information that we're going to need to have in place to start to think about the next phases of reopening in our schedules. And I know that you all as a leadership group are thinking about this, and I know that this is related to Steve's work every day in regard to just reopening the economy in the town. And so our worlds are run in parallel, but they also intersect, and our work is really critical. But Laurel, your points about the scarcity of the doses also cannot be stated enough. It is not being reported here, but I'm gonna go out on a limb here and speak for the group. We would run the vaccination clinic all day, every day, if we had enough doses to do so. Is that fair to say, Ruth? Yeah,
Absolutely.
absolutely.
That's
Right.
the plan.
And so there is a scarcity. We do not have enough supply to meet the demand right now. And as that becomes more available, there will be increasing and more opportunities, which is a good thing. So I will give you a quick update on COVID numbers. Positive news, as of last night, we had 8 positive cases this week in the district. I got a note early this morning that there are a few more positive cases coming. That will be reported in next week's data, I promise. And so, but we have 7 student cases and 1 staff case, brings our total number to 230 students and 44 staff. That's since September context. Currently, we have 82 students in quarantine and 8 staff members in quarantine. The high number of quarantine, I think, comes from youth sports at the middle school level. So there's a little bit of a bubble that happened early last week and has continued into this week. So we sent out an email messenger last night with a hyperlink to the update on the COVID data that I'm referring to. There's also information, there's 2 other hyperlinks on that email about a survey for parents, and there's an updated school calendar that is on there as well. So of course, if we can help with anything, we would encourage you to please be in touch with our office. So thank you to the leaders on the call. And like Steve said, it's another day in person, which is a great day for us. So thank you.
Thank you. Anybody have anything to add? Nice positive update for a change. At the height of this, we were looking at over 300 positive cases every 2 weeks, or over 2 weeks. We've dropped that down almost in half, or probably in half, to 172 on the latest sheet. Let's see if we can keep that going down because we all look much better in green than we do in yellow. So we'd like to be changing our colors. So everyone, stay safe over the vacation weekend. All of our teachers and students recharge. Doug, as you as well, and your staff recharge. I know you're under a lot of pressure over there. And everybody remember it's Valentine's Day, and try to take a nice moment to enjoy a quiet moment with your loved ones. Okay. Wakefield, have a great day, and we'll see you soon. Take care.
Thank you.